Hello, this is Vaishali and reading from the book Spirit of Homeopathy, book written by Dr.Rajan Sankaran, section 4 Materia Medica, and the chapter is Situational Materia Medica of Some Remedy, part 2, and medicine is Calcarea silicata. This is the very useful remedy. Some of the main mental symptoms are anxiety regarding health, anxiety regarding money matters, fear of poverty, sensitive to reprimand, yielding disposition, talk to dead people, anxious, restlessness, frightened easily, anxiety, seeking support, means desire to be magnetized, cowardly, confusion of mind after mental exertion, thinks his disease is going to incurable, sadness, causeless, bashful, timidity, hurried, impatient, irritable from consolation. The closet remedy are arsenic, staphysagra, gelsemium, stramonium, and baryta carb. Physical symptoms I have observed are tremors, cold sweating palms, blue line on edge of the gum, cold moist fingertips. Anxiety regarding money and the fear of poverty shows that the person is coming from the poor family. It is a situation of poor background. Silicata does not have this but instead has an air of egotism. Calcarea silicata does not have egotism but rather bashfulness. Poverty is like a primary disadvantage. Silicata behave like a princess. Calcarea silicata rather like a pauper. He has to be careful in this spending money. Being poor puts him at a disadvantage. Therefore, he has to become a yielding. He cannot at any time assert himself. He would rather escape than stand up for himself. Calcarea silicata is not as obstinate as the silica, and silicata has rigidity along with the consciousness which is absent in Calcarea silicata. Therefore, Calcarea silicata compared with the staphysagra both have high sensitivity. Sensitivity to reprimand is an advantage. When you are starting at the disadvantage, then sensitivity keeps you safe. For example, if you are working under an irritated boss, if you are sensitive to his reprimand, you will avoid any argument and so prevent getting fired. Calcarea silicata therefore is man who is poor and at a disadvantage. He becomes sensitive to reprimand and yielding, and also timid and bashful, since this will help him. It is the situations where support are unavailable, unlike that of the Soranum, where there is fear of poverty but no support. So he becomes despairing. In Calcarea silicata, support is unavailable, so he turns to people for support and puts his trust in other people, goes to get psychotherapy, means desire to be magnetized. The divergence from other remedy come with anxiety about the health. It is not an ordinary anxiety but a severe one. It is seen in a teenage boy who ought to be out enjoying life but who come to the clinic, spending hours there, worrying about some sneezing, a cold, or the delusion of her heart problem. The fear is of having an incurable disease. It is not a simple fear. It is a fear that paralyzes them and prevents them from going ahead in the life. The only advantage of fear is that it makes them non-achievers, more dependent. It gives them an excuse for non-achievement and dependence, and this is where it differs from the staphysagra and silicata. Staphysagra is the competitor. Calcarea is a defeatous, means loser. Silicata is a person who will try to reach high and ideal. Calcarea silicata is one of give excuse not to reach at that point, like a silicata. It seems that they come to the doctor with the hope that they have a serious disease, as if they would like to be so. They appear frightened. You see fear of disease on the face, but subconsciously they use this fear to do nothing. At this stage, when you contradict him saying that he does not have anything, he can get irritated, means consolation aggravates. Total lack of confidence exists in this remedy. And Cilicia also has irritability from the consolation and desire to be magnetized. This appear to be contradictory. Calcea silicata wants supports but would not like it to be said that they do not have anything. This great dependability on people, especially financially and socially, brings it close to the brighter cow. When such a person dies, means supporter dies, Calcea silicata can be devastated. He can go into the in the shock state. Automatic conduct. He will at that time automatic conduct observed. He will sit still and do nothing, or as a survival mechanism, he may imagine that these people are not dead. Talks to the dead people. This is the rubric. See, imagine that her husband is in the next room. They are wives who are emotionally and financially dependent on others. Calcea silicata is a person who is financially and emotionally dependent on somebody else, and due to some disadvantage, it may be real or unreal, is not able to face the world, offer the competition, and so avoid the world. Calcea silicata act as if he were a disabled son of a not so rich father. The original situations come from the disabled state, not so well-to-do family. Barata carbonica is very similar. Barata carbonica is disabled in another way. Calcea silicata is disabled in a way that he is not able to achieve what his parents want him to. Therefore, he needs an excuse for this. The really disabled man does not need an excuse, but a Calcea silicata consciously looks for an excuse not to achieve. What the family wants him to achieve is usually money. Poor class parents expect their son to reach a high status, but the boy finds that he is unable to fulfill their expectation. As it is there is the relative disadvantage of being poor. He finds the goal set by his parents too high, so he has to be financially dependent, and in order to be so, he becomes mild and yielding. Calcea silicata, the boy who's not so rich parents expect him to achieve things beyond his capacity. This is the situation of the Calcea silicata. It explains three things. Why most of the Calcea silicata patients are male? Because in India, the male is expected to achieve. And number two, why are most Calcea silicata patients teenagers or just over this age? Because this is the age when the demands of the parents are maximum. And number three, why are most Calcea silicata patients really non-achievers? Because they comes from the demanding yet supportive families. Barata carbonica situations, the person is really disabled and so feel incapable, while in Calcea silicata consciously feels the needs to achieve, which Barata carbonica does not feel. In Staphysaria, survival depends upon the achieving, as also in Cilicia and Lycopodium. Whereas in Calcea silicata, the patient has almost given up effort at achieving, and his survival depends upon finding excuse not to achieve. Calcea silicata are not total failure, means not non-achievers. They do achieve, but much less than what was projected for them. In short, Calcea silicata has to do with the money and expectations and neurosis. No wonder it is one of the most frequently indicated remedy in India, which has to do with the poverty and expectation.